Task Force team. There he is. Let's listen in live.
As of today, we have 1,721 new cases reported and 906 people in the hospital. And today is the second highest day in both of those categories since the pandemic started. We also have 1,271 people who have died, and we continue to pray for those we've lost and their families. North Carolina has been careful in lifting COVID-19 restrictions. And it's because public health experts warn that removing restrictions too fast or all at once can cause a dangerous spike in the virus that would overwhelm our medical system. That would not only harm people with COVID-19, but also those needing treatment for other conditions. Our cautious approach here is like the dimmer switch rather than the on-off switch. Over the past weeks and months, even as we've slowly turned the dimmer switch up and eased restrictions, we've seen community spread of the virus increase in North Carolina. Daily case counts have gone up. The percent of tests returning positive has stayed high. Since May 19th, the number of people hospitalized has increased 56% from being in the 500s to now over 900 in just a little over a month. Doctors and healthcare experts have warned that hospital capacity can be overwhelmed in the blink of an eye. And once we see that capacity is gone, it can be too late to reverse the tide. Testifying before Congress yesterday, Dr. Anthony Fauci said that North Carolina could see a, quote, insidious increase in community spread, which will be much more difficult to contain as community spread amplifies itself, end quote. He cautioned that leaders in our state have to act to blunt the surge of cases. He also testified that the next couple of weeks are critical for our country in the fight against COVID-19. Before we talk about today's actions, I'll ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to walk us through the same data that has been driving our decision-making in this pandemic. Dr. Cohen.
Thank you, Governor, and thank you for your ongoing leadership and for the decisive actions that you continue to take to help protect North Carolinians during this pandemic. I'll now walk us through our latest trends. As a reminder, we look at a combination of trends that guide our decision making. They include COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. These were chosen based on public health data and White House guidance. And remember, we cannot look at any one of these metrics in isolation. We really need to see them as a whole package when making decisions. And remember, each of these data points has its own limitations. So in our first graph, we look at people who come to the emergency department with what's called COVID-like symptoms. This metric serves as an early warning indication mechanism for us. Looking at the yellow line, you can see there's been an increase in this metric over the past few weeks. This upward trend is concerning. Now, moving on to laboratory confirmed tests. Again, as you look at the yellow line, you'll see that the 7-day average shows that last week started to level, and that's some good news. However, this trend has continued to be elevated through most of our phase 2 opening. And today, we saw the second highest number of cases at 1,721. We really want to see this trend stabilize. Now, this next graph shows the exact same data that we were just seeing, the lab-confirmed cases, but now we're zooming in for a closer look. This graph, again, shows data since May 15th and not all the way back to March, so you can see it in more detail. Looking at the yellow line, again, shows that slight leveling in the last week, but today also shows that second highest day of new cases today. Moving on now to the percent of tests that are positive. This metric provides important context to our number of cases. I want to draw your attention to the yellow line, and what you can see is that the percent of total tests that are positive continues to be elevated. Unfortunately, we would like to see those numbers be closer to 5%. This metric helps us understand that our increase in cases is not just due to more testing. It indicates that the virus is still very prevalent in our state. On this next metric is day-over-day hospitalizations. And the yellow line shows that North Carolina's trajectory of hospitalizations is rising, as the governor said. Yesterday was our highest day of hospitalizations with 915 people in the hospital. Now, our hospitals still have capacity to meet increased demands if more people become seriously ill, which is good. But the fact that this metric has continued to climb for more than a month is concerning. We would like to see this at least level or certainly decline. If this upward trend continues or worse, accelerates, we could face capacity challenge within our healthcare system. Okay, so here's where we are. Surveillance data shows an upward trend. That gets a red X. North Carolina's trajectory of lab-confirmed cases is starting to level, but it's still climbing. It gets a red X. North Carolina's trajectory in positive tests returning positive remains elevated, and it's much higher than we would like to see, so this gets a yellow line. North Carolina's trajectory of hospitalizations is rising, though we still have capacity in our healthcare system, so this trend gets a yellow line. As far as our capacities that are critical to allow us to respond to this pandemic, here we continue to see positive trends. Testing has an upward arrow. We're averaging more than 17,000 tests per day now for the past week, and we have more than 500 sites listed on our websites, plus additional testing pop-up sites. However, North Carolina labs and labs around the country are starting to see supply shortages again for laboratory chemicals called reagents, a key component needed to process tests. We need the suppliers and the federal government to work with us to resolve these issues. This is a concern. There are over 1,500 full-time and part-time staff supporting our contact tracing efforts, and our PPE supplies are stable. We have enough critical supplies on hand to fill requests for at least the next 30 days. So these concerning trends remind us that if left unchecked, the virus will continue to spread. But we have the power to get these trends moving back in the right direction, but we need your help. Wearing a face covering in public settings is a simple but powerful action to slow the spread of this virus. The scientific evidence is compelling. However, face coverings only fully work when we all do it. If each person commits to wearing a face covering, we can stabilize our COVID-19 trends. We all have a role to play, and it starts with the 3 W's. If each of us commits to these simple actions, we can fight back against this virus. We can protect our families, our friends, and our neighbors, and get back to the people and the places we love. Thank you, Governor.
Thank you, Dr. Cohen. The numbers we see are a stark warning, and we must pay attention. I'm concerned. As we've watched and studied and dissected these numbers in recent weeks, that concern has grown. Since the beginning of this pandemic, I have been clear that data and science would lead the way. In following that standard, it's clear that our numbers will keep us from moving ahead into the next phase of easing restrictions. So today, I'm announcing that North Carolina will pause and continue our Safer at Home Phase 2 for another 3 weeks. Now, this is not where we plan to be or wanted to be, but it is one of 2 important decisions that we need to make to effectively fight this disease. The other important decision is requiring face coverings when people are out in public. People must wear face coverings when in public places, indoors or outdoors, where physical distancing of 6 feet from other people who are not members of the same household or residence is not possible. They will be required for all employees and customers of retail businesses and restaurants, as well as workers in manufacturing, construction, meat processing, and agriculture settings. There are exceptions, including people with medical conditions and children under 11, people who are at home and people who are walking and otherwise exercising outside when not within 6 feet of others. Overwhelming evidence that is growing by the week shows that wearing a face covering can greatly reduce the spread of COVID-19, especially from people who have it and don't know it yet. Face coverings are a simple way to control this virus while protecting ourselves, our families, and the other people around us. One important point here: required face coverings not only cause zero harm to our economy, they in fact help our economy by making it safer to shop, do business, and keep our small businesses running. We're adding this new requirement because we don't want to go backward. We want to stabilize our numbers so we can continue to safely ease restrictions and, most importantly, get our children back in school. I urge everyone to be a leader in wearing face coverings. I encourage businesses to be strong in enforcing it. Slowing the spread helps our economy, and these face coverings do that. And as we watch the trends during this pause, we hope to be able to ease restrictions on playgrounds, museums, and gyms on July the 17th, 3 weeks from Friday when this order expires. Now, I know this virus has been very difficult for business owners still under restrictions who are anxious to open their doors. We want them to open safely. The safety and health of our people is the top priority as we navigate this unprecedented challenge. Already, North Carolinians have come together to get us through this, supporting healthcare workers, small business owners, frontline workers, reaching out to those most in need of a helping hand, looking out for our neighbors who may be having a hard time right now. This virus has changed our day-to-day lives, but it won't change who we are.